I think the issue of, of liposuction and lipocontouring, especially with the non-surgical options such as Coolsculpt, or we have two machines, we call it Dual Sculpt, that's sort of shrinking away an area. It's sort of making it smaller. It's almost like having an isolated weight loss in an area. But that's not exactly what we do when we're doing liposuction or body contouring. Because in body contouring, whether it's a tummy tuck or liposuction or a thigh lift or whatever it is, we're actually trying to sculpt an area. Maybe we're adding fat to the buttocks too to sculpt it, right? So we're sculpting and we're creating shapes. Maybe we're etching the abdomen to make somebody have a more contoured abdomen. I'm always looking like a sculptor at what I'm leaving behind. It's the fat I'm leaving behind. And then secondarily, I just take away the unneeded fat to create that sculpture, that look. And that's something quite different than what sort of non-invasive fat melting procedures or fat freezing procedures do, which just sort of shrinks the area. And so patients are always saying, which is better? And I'm like, well, it depends on your goal. If you just want to shrink an area, gain a little weight in an area, and you don't want to have surgery, then these other techniques like Coolsculpt would be great. But if you want to have a contour, and you want to have a waistline, and you want to have areas of shape where you leave a little fullness in certain areas and you take it away aggressively in others, then you can only do that with a surgeon's hand and with sculpting. And so they are providing two different results, and they're not really interchangeable. So I don't think it replaces liposuction, because I don't think I did liposuction to just shrink an area a little bit. I never did it that way. I always did it to sculpt an area, every time, wherever we're talking. I wanted to take all the fat away I didn't want, and then create a shape around it that I wanted, and that's a little different. So I think that when patients keep that in mind, then they'll know which consultation they should have for a non-surgical, non-invasive fat melting or fat freezing procedure, or a surgical procedure.